Mary McMasters, truly a nurse to be proud of. 100% commitment to patient care, to staff welfare, 100% dedicated to the organisation. It has been said, if you wanted a nurse to look after you, choose Mary, and that's why there's something about Mary.
I think Heather should win this award because she's been crucial in setting up the new service that we've been running as part of the GU Med clinic, which is a Wednesday evening clinic and also a Saturday morning clinic. Heather is very popular amongst all our patients as well as all the staff in clinic, and her involvement with UHB isn't just limited to the clinic itself. She also helps out in terms of extra shifts at the new hospital and is also a night sister as well.
Joan has spent all her working life building up a distinguished career in nursing. Following retirement, when many people choose to put their feet up, Joan chose to become a volunteer for the haematology team, and we're so glad she did. She's always willing to give her advice and support in any way she can. She was instrumental in the setting up of the haematology patient support group and raises funds throughout the year, which goes towards funding meetings and excursions for patients and their carers. We've loved Joan for her care, kindness and generosity that she shows to patients and staff, and the unit would not be the same without her.
My name is Rosanita Gargarita. I am the ENT staff nurse here at Queen Elizabeth Hospital. I know Mr. Proofs many years ago. He pioneered Baha and cochlear implants in this trust. He is known clinically in this field of expertise nationally and internationally. He's often requested to teach across the world. I would be proud to say and recommend Mr. Proofs for this award. Thank you.
Betty's been a member and a volunteer with us for many years. She started as one of our very first welcomers at the Queen Elizabeth Hospital, and then she went on to work in our bereavement care office, where she still supports bereaved families today. Betty's also worked with our Patient and Carer Council and with the many subgroups, and she's provided a huge amount of help in the way in which we've developed our patient experience. I think Betty really deserves this award, and I know that she would be delighted to accept it.
I've nominated Gina for the Best in Care award because 12 months ago I was diagnosed with breast cancer. Minutes after getting that diagnosis, I was put into Gina's care. I struggled to put into words her kindness, her professionalism. She saw myself and my husband through the whole experience. And what touched me the most was every time she saw my husband, she would ask him how he was, accepting that it is not just me, but it's the whole family.
I'm nominating Adam Johnson from the Plough in Harborne. Adam and his team at the Plough have been phenomenal supporters of the Young Persons Unit at the Queen Elizabeth Hospital. They introduced onto their menu a fish finger sandwich, and 25p for each sandwich that they sold went to the Young Persons Unit. They have collecting goblets on the bar at the pub, and Adam this year is also undertaking the Birmingham Half Marathon, which I think is fantastic.
Tony is the epitome of a first-class team member and deserves recognition because of the vital role he plays within the liver unit theatres. He has outstanding knowledge of the procedures, equipment and needs of not only the theatre but also the staff and the patients. Much of what Tony does, above and beyond his role, ensures excellent patient care. He is very much one of the unsung members of the liver unit, something which epitomised Pat in the ENT, and therefore I cannot think of a more worthy winner of this award.
I've had the great pleasure at working closely with the IV team over the last couple of years, and I've really grown to admire the tenacity with which they throw themselves headlong into their work. They've always maintained a really high profile around their area of expertise to enhance the management of IV devices, reduce risk and bring best practice to our patients. Deb provides really strong leadership for the team, and all in all they've been great colleagues and jolly fine fellows to work with. Thank you.
I think Viv deserves this award She is a very special person who is caring to all of her patients. I've worked with Viv for 6 years, and the feedback I get from patients and their relatives is that she is a special person.
Anyone you talk to who's ever worked with Nigel will tell you the same thing, that he's a great guy, he's really nice to work with, and he's very, very enthusiastic, and he's very professional in everything he does. I'm stood in the atrium of the brand new hospital, and he should and could take certainly some credit for the fabulous achievement, particularly in terms of his support to make sure that it was delivered on time and, more to the point, on budget.
All right. I've worked with Sue Smith for 10 years, and she's always been polite, courteous and extremely helpful to all the patients, going the extra mile and arranging access to the consultants whenever it's necessary. She's also a delight to work with within the team, and everyone supports the nomination for her.
The reason why I nominated Lorraine is because she's always in control and she always knows what she's on about. She's just a wonderful person. She's always on the end of the phone if I need her, and she knows 100% about my condition, and she gets how I'm feeling. She's just a wonderful, wonderful person, and she really deserves this award.
Hi Professor Buckles, who'd have thought I'd been here 5 years on when I was diagnosed with pancreatic cancer. I'd like to thank you very much for all the help and assistance you've given me through this very difficult time, and including all the complications I had afterwards. You've always been there for me, you've told me how it is, and I thank you for that. Well done on this nomination.
I've had the privilege and pleasure of working with Professor Buckles for many years, and during this time I've seen a complete expert at work. His communication skills and his empathy with patients is outstanding. He's loved by all his patients. He's been a fantastic role model and teacher, and I miss him dearly, and I'm absolutely delighted that he's been recognised with this award this evening.
I've known and worked with John Buckles now for the best part of 20 years, initially as a surgical trainee and more latterly as a consultant colleague. I can honestly say that I've never worked with a better technical surgeon. He's taught me everything I know. It's not all about his technical surgery, however. He's a fantastic doctor. His ability to diagnose patients is second to none. He's a fabulous trainer. He's taught many hundreds of surgical trainees from the United Kingdom and in fact all over the world, and transferred his skills all around the globe. He's also a fantastically supportive consultant colleague, and in addition to that, he's a comedian. We've had some fantastic times on the liver unit, mainly down to his light-hearted nature and approach, and I can honestly say that there is no one who deserves recognition for his surgical skills and his innovation any more than John Buckles. It's commonly said that people are indispensable, but I think in John's case he really is. And already on the liver unit we're missing him, and I'm sure we'll continue to do so. However, we all wish him well in his retirement.
Firstly, I'd like to say how sorry I am that I cannot be with you today. I'm visiting my daughter in Perth, Western Australia. It's only been 29 degrees centigrade today. Actually, I'm very honoured to be given this award, and I'm grateful to those people who nominated me. I started at the Queen Elizabeth in 1969 as a student on Ward West 5. I did a lot of my surgical training at the hospital, and I was delighted to eventually be appointed as a consultant there. The liver unit's been a fantastic place to work, and I'm very grateful to the staff, both past and present, for the support that they've given me. They're an outstandingly professional team, and I could not have asked for better colleagues. I wish you and them all well for the future. I have asked Kath to say a few words on my behalf. I just hope she sticks to the script. Thank you very much.